The jabs are ready to go, but are people ready to get them? Perhaps not. Booster clinics should be busier. Those getting jabbed don't understand the reluctance.
If they've had two and they won't have the third, it's very hard to explain. I mean, I understand those people who don't have it at all. They just make life difficult for everybody else.
We are a bit too devil-may-care about the whole thing. We feel that the wave has passed over us. A lot of us have been vaccinated, and that's enough.
More than 3.8 million people have had their COVID booster, but over 4 million who are eligible have not. This partly explains why. The yellow line shows every week 1.3 million people are getting booster jabs, but as the brown line shows, every week another 2 million people become eligible. Only 47% of over 80s who are double vaccinated have had their booster. That figure is even lower in the younger age groups, who had their second vaccine later. And it's worrying health chiefs.
Whilst it's great that people are coming forward for their boosters, they are not coming forward as quickly when they receive their invitation as we certainly saw for the first jabs. So it's really important that we now absolutely do get the message out that COVID is still with us.
The reason boosters matter is simple. Without them, immunity fades. And if immunity fades, infections and hospitalisations could rise. That puts pressure on the NHS and even risks a return of restrictions. COVID cases are already creeping up and rates are highest among children. The 12 to 15-year-old vaccine rollout has slowly started, but with half-term and Christmas come concerns about mixing. One public health director has told schools to bring back bubbles.
What we're seeing now is an increased rate of number of children off school. So particularly now, it's our time to say, here's some further action, here's some further suggestions and recommendations for schools to take, with the primary aim of keeping those pupils at school.
Children can now visit vaccine clinics during half-term to help the rollout keep up with increasing infections. Otherwise, we'll be well into winter before our most vulnerable are properly protected. Laura Bundock, Sky News.